Namaskar. Welcome to Toxicology on Board. Today we will discuss question number 13. The topic is mercury poisoning, organic mercury, inorganic mercury treatment. Okay, let's directly go to the question. Which of the following is not true of mercury poisoning? Option A, ingestion of the inorganic forms is less toxic than organic forms. Option B, is more toxic when the central nervous system is involved. Is effectively treated with calcium disodium EDTA. Option D. The methylated form has been implicated as human teratogen. Option E. Fish may contaminate enough mercury to affect human under some conditions. So the question is, which of the following is not true for mercury poisoning? Okay. The right answer is option C, is effectively treated with calcium disodium EDTA. So this is not the right option. So other options, option A, option B, C, D, E are applicable to mercury poisoning. Okay. So this particular diagram I have already discussed before in one of my previous videos. Okay. So you can go back and again see how mercury is affecting various organs and causing toxicity. Important thing, if you want to remember, you can remember that it is affecting reproductive system. Okay, abnormal menstrual cycles and reduced fertility. And important thing, if you want to remember, you can remember here is nervous system. It is causing neurodegenerative disorders, Parkinson's and Alzheimer's. Okay, brain damage, poor performance on test of mental function. Okay, apart from this one question, another second question also we are going to discuss in this video. Both the questions were previously asked in the DABT recertification. So which of the following is are differences in the chronic toxicity of inhalation elemental mercury and the toxicity of ingested mercury salts? So this is another very good and classic example where a chemical based on the route of administration, its toxicity differs. Here inhalation route and that to form, you can see elemental mercury, the toxicity is different. And ingested by oral, if the route of administration, the exposure is through oral and it is in the form of mercurious salt, then the toxicity, that particular same chemical will behave differently. So what elemental mercury is causing? Elemental mercury is causing tremors, gingivitis and increased excitability. Okay, it is affecting nervous system as well as the brain. Whereas mercury salts causes acrodynia, fever, increased activity of sweat glands. Moreover, it is like a dermal related symptoms are there. Okay, hypersensitivity reactions are more commonly associated with mercurious compounds than with mercury vapor. So you have to understand the same chemical whenever the form is changing, whether in the form of elemental form or in the form of salt form, and based on the route of exposure, the toxicity is differing. The target organ is toxicity is also differing. Okay, so exposure of mercury is mainly through diet, through occupational, through medicinal as well as through accidental. Okay, why medicinal means in the historically this mercury had was used in the preparation of amalgams also. Okay, so you can go back and read the history of mercury. Okay, so main thing in this particular slide we are going to learn about minimata disease. Minimata disease, which is involved contamination of fish with methyl mercury. Okay, earlier also in my previous videos I have discussed, this is the chizo plant which was responsible, which was next to the river body. It excluded this industrial waste which basically in large quantities contained mercury. Okay, here you can see a person, the who is diagnosed with minimata disease. Okay. And here you can see the fish which is contaminated with mercury. Let's directly go to this particular diagram and understand. So this is directly taken from Clayson book, okay, chapter Toxic Effects of Metal, page number 1146. So what is happening in this case is that the movement of mercury in the environment. In nature, mercury, if you see Hg, it is in the form of mercury vapor. Okay, a stable monoatomic gas evaporates from the earth. Okay, uh, surface, both soil as well as water, and is emitted by volcanoes. So either from the industrial waste or the volcanoes, this mercury vapor form of mercury is released into the environment. Okay, slowly after 1 year, you can see anthropogenic sources Okay, man-made sources include emission from the coal burning power stations and municipal incinerators. Approximately after 1 year, as I said, no, after 1 year, this mercurious gaseous form will convert it into Hg plus 2. Okay, vapor is converted to soluble form Hg plus 2 and returned to the earth by rainwater. So whenever there is a rain form, this mercurious salt form, no, soluble form, it will come into the water bodies. Okay. um, and returned to the earth by rainwater. It may be converted back to the vapor by microorganisms and re-emitted to the atmosphere. Thus, mercury may recirculate for long periods. So you have to understand, even after first exposure also, there are certain chemicals which will retain in the environment for a long period of time. So mercury is also one of such example. Mercury attached to aquatic sediments is subjected to microbial conversion to methyl mercury. See, you can see first it was in gaseous form, then it converted into soluble form. Now this is becoming converting by the phytoplankton, so that the microbial conversion is taking place and it is converting into organic mercury, methyl mercury. Okay, starting with plankton, then herbivorous, then fish, then finally ascending to carnivorous fish and sea mammals. So here you can see this is a best example of biomethylation or biomagnification, results in human exposure to methyl mercury through contamination fish. Whenever human consume this contaminated fish which contains methyl mercury, okay, they pose health risk to the humans, especially the developing fetus. So lot of cases are there. Minimata disease, methyl mercury toxicity, I have been discussing this in the previous videos also. Okay, because even mother is getting exposed to this. After first generation, second generation, their babies also still contains this toxicity, where they are showing signs of CNS toxicity is there, tremors, conversions are there. Okay, it is able to cross the fetal the placental barrier. So important thing that you have to remember, minimated disease, the type, the form which is caused is methyl mercury, not inorganic mercury. In your options you will find this one. Okay, and this is also important, biomethylation, biomagnification. I'm telling you in terms of exam point of view what you need to remember. Okay, then next, so mercury vapor, same thing which we have discussed in the previous slide. Here we will see in this particular slide also. Mercury vapor is much more hazardous than liquid form. Okay, mercury binds to other elements such as chlorine, sulfur, or oxygen to form inorganic mercurious Hg plus 2 or Hg plus 2. So two oxidation states it is existing in the nature. Same thing you have learnt about chromium toxicity also. Chromium also exists in various oxidation states, and you have to remember which is the form, which is the oxidation state which is causing more toxicity. Okay, the metal can form a number of stable organic metallic compounds. Okay, by attaching to one or two carbon atoms. Okay, methyl mercury, CH3 Hg plus or methyl mercury is the toxicology most important organic form. Okay, next, mercurial compounds have characteristic toxicokinetics and health effects that depend on oxidation state and associated organic species. As I said, remember even chromium or vanadium, there are certain chemicals are there, metals are there which exist in certain oxidation states which are responsible for causing toxicity. Okay, so here he is saying that methyl mercury is the one which is toxicologically more important. Okay, then next, toxicity, we have to read about mercury vapor, inorganic mercury, as well as methyl mercury. Methyl mercury is organic mercury. Mercury vapor is HgO. Okay. Next, mercury ions, they will cause toxicity to the kidney. Okay. In previous videos we have learned it is affecting PCT, proximal convoluted tubule. Okay. Whereas methyl mercury, organic form, is causing nervous tissue CNS toxicity, toxic to nervous tissue. Symptoms of chronic intoxication with methyl mercury vapor include tremors, stomatitis, proteinuria, erythism. Go and read about erythism, which is also called Mad Hatter disease. Okay, okay, there is historically there are some cases. This is something industrial symptoms you can see. There are certain people who were, you go back and read about Mad Hatter disease, then definitely you will understand. I will discuss about Mad Hatter disease in some other. So erythema is also called Mad Hatter, where you will have some mental confusion or CNS related behavioral changes will be there. Okay, then next we learn about treatment. Therapy for mercury poisoning should be directed towards lowering the concentration of mercury at the critical organ or site of injury. So very important. Whenever a patient is exposed to a certain chemical, okay, toxic chemical, first thing what you have to do is you have to make sure that there is no further exposure, or first there is no further exposure to that particular chemical. Okay, you have to wash out. Remove the clothes, all these things have to be done. But here in the case of oral injection has taken place, so you have to, what you have to see is that further absorption you need to stop. Okay, lowering the concentration of the mercury at the critical organ or site of injury. Okay, for most of the severe cases, particularly acute renal failure, hemodialysis may be the first measure. Okay, already absorbed, the drug has reached into the systemic circulation, so you perform hemodialysis. By performing hemodialysis, you remove the mercury from the blood. Okay, along with the administration of chelating agents, unabsorbed form can be uh, removed by adding chelating agents like cysteine, EDTA, BAL, or penicillamine. Chelation therapy is not very helpful for alkyl mercury exposure. Again, the form of mercury is also important. Which type of treatment can be applied to which type of mercury form? So chelation therapy is not very helpful for alkyl mercury exposure. Okay, biliary excretion and reabsorption by the intestine can be interrupted by oral administration of non-absorbable. So thiol resins can be used, which can be bind mercury and enhance fecal excretion. Okay, so those which are excreted to bile excretion pathway, you administer thiol resin. Okay, they will enhance fecal excretion. Next, treatment of ingestion of inorganic mercuric salts. You can either use DMSA, that is nothing but dimercaptosuccinic acid, or 2,3-dimercapto 1 propane sulfonic acid DMPS, or N-acetyl D-penicillamine NAP. Okay. So in this video we have learnt about mercury, various forms, organic, inorganic, as well as vapor form, and what are the antidotes, and we have learnt about biomethylation and biomagnification. Okay, and hope we have also seen two different questions. Okay, hope you have learnt about the this add more to you towards the topic of metal toxicity. See, each metal by itself will have again wide information. All cannot be read in one single video. Okay, so based on question, that particular content only I am try to discuss throughout the options. Okay, hope be curious. For any questions, please comment or write a mail to arya.priyanka18@gmail.com. Like, subscribe, and follow my YouTube channel Toxicology on board. All the best for your exam. Thank you.